How often have you heard someone being diagnosed with breast cancer? Today I'm here to inform you about breast cancer and breast cancer awareness. My name is William Summers, and I'm a registered nurse. I've been a registered nurse for about 10 years and caring and treating patients that have been diagnosed with breast cancer. I feel that a better knowledge of breast cancer can kind of help you informed and have you better be able to use the benefits of being proactive in breast cancer. Breast cancer awareness basically is we're going to define breast cancer. We're going to learn about the signs and symptoms of breast cancer and also the treatments and that are available for better outcomes for breast cancer. We're going to look at 3 points, and the first point is I'm going to bring us to our visual here. And basically, what is breast cancer? Breast cancer is basically a cancer that affects the breast tissue and also the lymph nodes in the axillary area or the armpit. According to Tyrone, breast cancer is the most common cancer that's diagnosed in women. It's also the second leading cause of death in cancer among women. There's also a study that was done by Byron, DeSantis, May, and Jimmel that states that the ages of 50 to 74 are the primary ages that women are diagnosed with breast cancer, and that 1 in 8 of those women in that category will be diagnosed with the diagnosis of breast cancer. And as we see here, it says men and women are also affected both by this. It's not a gender specific cancer. It affects everybody. Block and Morondo done a study, and it says that more males die from breast cancer than they do testicular cancer, which is kind of a unique aspect of this. Our next point is going to be on the signs and symptoms of breast cancer, which brings us to our next visual. Palpable mass is going to be your biggest thing. When you look at those, that's why we're doing those, performing those nice self-checks and so forth. It's going to be in the breast area or in the axillary area or the armpit area. An abnormal mammogram for those people who are getting screened in the ages of 50 to 74. And the American Cancer Society suggests that we basically, for young women on to their elder ages, to take them basically visualize their breast and what they look like, their nipples and so forth. If there are any changes, dimpling, any deformity and so forth, that will be a reason for a concern for them to use their doctors. Also, we look at risk factors such as obesity. Genetics are always a big thing. Family history could put you at that risk. And there was a study that Ozan, Holm, Omer, and Esserman performed that actually is a diagnostic tool that your physician can actually use and input risk diagnosis and so forth that they have found into this website. It's on breasthealthdecisions.org that actually can give you a better synopsis of where you stand as far as your treatment options or if you are at risk and so forth. Our third point is diagnosis and treatment. Obviously, we're doing our yearly exams. We're going to the doctor. We're getting our clinical breast exams done by our physician. Obviously, mammogram is the best way of diagnosing breast cancer, and it's relatively stated that women in the ages of 50 to 74 need to have that done biannually, and for those who are younger, the high-risk group. Needle biopsies can be performed to confirm that you are or aren't have a diagnosis of breast cancer, and also they can define what type it is, the stage it is, and then we can define what treatments to do. Those treatments could be chemo, could be surgical, or it could be radiation, etc. In conclusion, today I've informed you about breast cancer awareness. Specifically, we've been informed about the definition of what breast cancer is, the signs and symptoms of breast cancer, and also the treatment options that are available for breast cancer. I want to thank you, and hopefully you've learned something about breast cancer today. Thank you.
Thanks, have a good day. Bye.